Welcome to Your Health. I'm Melinda Meza, and this week we have Dr. Walter Tom from Aesthetic Laser and Vein Center with us. Thank you, Dr. Tom, for joining us. And today we are going to talk about veins. We don't have to deal with those unsightly varicose veins anymore. So tell us, what are you doing there at Aesthetic Laser and Vein Center?
Well, back in 1999, I actually opened up the Aesthetic Laser Vein Center in Santa Rosa, and then in 2004 we opened one up because of the demand in Napa, and we've been very excited for our patients. Probably in talking about all of these issues with you, Melinda, if I wanted to tell our viewers one thing, it would be, don't be afraid to come in to take care of your veins. They're old wives' tales about how painful it is, how it lays you up for a long time, and there's such a long recovery period. Now it's all fallacy. There are a lot of new ways of dealing with spider veins as well as varicose veins.
Okay, so what are you doing there then?
Well, for spider veins, for instance, and for our viewers, those are the little blue veins that we see on our legs, okay?
The little firecrackers?
Those little firecrackers,
Okay.
okay, exactly. Look like little spiders, that's why we call them spider veins. And for the legs, we still find that using a very tiny little needle and injecting solution into those veins, we can help them to disappear. Now, I saw your eyes go up because I said needles, and I'm thinking, wait a minute, Dr. Tom, you said that this was supposed to be not painful at all. And I'll tell you that I've had this treatment, and I'm a big weenie. So if I can do this, anybody can do this.
Okay,
and our
that's
nursing
good to
staff
know.
are great, and they've injected my legs. But what we do is take a very tiny little needle, you barely feel it, feels like a little insect bite, and we inject these little veins with medicines that helps to close them down. And we found for leg spider veins, that's still the most effective treatment.
Now, some people get these varicose veins after they've had children, a lot of women after they had children, but they don't have to deal with it anymore. There's more advanced procedures if you have the thicker
Varicose veins, right.
Right.
Sometimes we get patients, their veins are as large as maybe your thumb. I mean, they're
Wow.
huge and they've lived with them for a long time. Interestingly enough, and I mentioned to the viewers that to not be afraid to come in, is that probably over 90% of the patients who have problems with both spider veins as well as varicose veins, that they can be treated, Melinda, without surgery. So just as we do for the spider veins of the legs, we can take a solution which does not burn when it goes in.
Now, there are some patients who really have quite large veins, and one patient that I talked to told me that her doctor told her she needed surgery.
Yes, for those patients now, we have a very unique procedure. We actually call it the ELVIS procedure, and it's an eponym for endo-laser vein system. And what we do under local anesthesia, instead of stripping out the large vein that's producing all the other varicose veins, under local anesthesia, we actually place a laser fiber up that vein. We inject local anesthesia along the vein so the patient feels nothing at all, Melinda. We activate the laser fiber, and as we slowly withdraw the laser fiber, the vein, it seals the vein shut, so it closes the vein down. And it's a great way to take care of the patients. It circumvents needing the traditional stripping that everybody's afraid of. Patients go home that evening, they have their legs wrapped. The next day they take their wraps off, take a shower, put on the compression hose. I tell them to take it easy for about 24 hours, but most patients are driving after about 48 hours on the road.
And this is great news.
It's great news. The patients are very comfortable, and in my opinion, I believe that the need to do traditional stripping should be very rare nowadays.
Who's the perfect candidate for this type of treatment?
Well, Melinda, it's actually anybody who has varicose veins, and we've taken care of patients who have been in their teens, believe it or not, who just genetically have varicose veins. But probably my most favorite story is that of an 83-year-old gentleman that I took care of with bad varicose veins. He was the salt of the earth kind of guy, wearing a USS Arizona hat on. Came in to see me. We did the ELVIS procedure on him, got rid of his varicose veins. And when he came back to see me in the office the following week, he said, "Dr. Tom, I'm so excited." He said, "These 83-year-old legs are going to see the California sunshine for the first time next summer in 50 years. It was amazing. He was so bothered by his legs, and a salt-of-the-earth kind of guy, as I mentioned before, and he never wore shorts for over 50 years, and then he was going to wear them next summer. So that was really very touching to me.
See, and that made such a difference in his life. Some people might think that, you know, getting your varicose veins taken care of is a bit vain, but for this gentleman, he's going to wear shorts again that he hasn't worn for 50 years.
He is, and actually people don't realize by taking care of your varicose veins, you're actually improving the health circulation of your legs.
Awesome. So you're doing this at a Aesthetic Laser and Vein Center. You're located on Stony Point Road in Santa Rosa now.
Yes, we are.
And you have an office in Napa. And what street is that on?
On First Street.
On First Street.
Easy to remember, on First Street in Napa.
Aesthetic Laser and Vein Center with Dr. Walter Tom joining us today on Your Health. I'm Melinda Meza.